We thought that may be very interesting to see whether telomeres in any way affect the outcome in chronocytic leukemia. Telomeres are the ends of the chromosome. They get shorter as we get older. Interestingly, women have longer telomeres from birth. So from birth they're doing better than men. So it's something with us all our time. And as each cell divides, the telomeres shorten. So telomeres give you an idea of the replicative history of the disease. But also as the telomeres get shorter, they get stickier, which means the chromosomes are more likely to stick together, which means you can get more genetic damage such as P53 and 11q, those important prognostic markers we know about in CLL. So our project in Cardiff started around 2009 when we started looking at patients with CLL to see what was actually what their telomere profile was. Very surprisingly at the time, we found that CLL patients had the shortest telomeres of any human cancers described up to that time. So although in a sense we have this feel with CLL, it's a disease which is quite quiet for a lot of patients, what this actually showed is before the patients actually get to us, there's a very big replicative history behind these patients. What we then went on to show is that those patients with short telomeres did significantly worse than those patients with long telomeres. We compared those results with all the other known prognostic markers, cytogenetic, CD38, ZAP17, beta-2 microglobulin, and the telomere length came out as the single most important at predicting the response to therapy, as well as predicting how well patients would do before they required therapy. So it gives us an indication of what will happen to the watch and wait patients. Will they require treatment or not? Those with long telomeres, only 70% of patients required treatment in 10 years, whereas virtually all the patients required treatment within that 10-year period if you had short telomeres. So it gives you a 93% accuracy of whether your disease is likely to progress in 10 years, which given the average of age of diagnosis of a CLL patient is 72, gives you quite a lot of confidence that if you have long telomeres, you're going to do well.